Number of confirmed COVID cases in New York has topped 500,000 since March, but the state still has the second lowest rate of coronavirus in the country.
Nationwide, our positivity rate, we are now the second lowest in the United States of America. We've actually made progress nationwide. We are 1.3%.
New York City also making significant strides in tracking the number of positive cases across the 5 boroughs. Here to tell us more about it is the head of the Test and Trace Corps, Dr. Ted Long. Welcome back, sir. Thank you for making the time.
Thank you for having me.
So, Doctor, let me begin with the warning from public health experts who say, you know what, the worst is yet to come. How are you at the Test and Trace Corps bracing for this second wave, and what may have you learned from the first time around?
Yeah, it's a great question. So to be clear, if we do our job and we work together with New Yorkers, we can avoid a second wave. What you're going to see for sure is upticks in different communities across New York City. But what our job is to go into those communities, bring in massive testing. In the cluster zones alone in Brooklyn and Queens, we started 32 new testing sites, did more than 25,000 tests, worked with the community, handed out 2 million masks. That drove down the numbers. And now those zones are much, much better. Soundview and Sunset Park, we did a similar thing, drove down the percent of people testing positive by 2/3.
Did you learn?
We can and will continue to do that.
Did you learn from the first go around and what you're seeing now in Soundview and other neighborhoods where those upticks in certain communities would be? Maybe more black and brown communities that should have had more resources from the get-go so you can avoid an uptick before it even happens?
Yeah, you know, it's a good question. And we've strategically put all of our resources on our map of where we know they're needed the most, and in particular in black and brown communities and low-income communities. So we've planned ahead as far as we can, but there still will be community spread. So we still have to be nimble and mobile. So that's why in the clusters, the important point is we brought in 32 new sites in order to address that. And we will do that same thing as we see upticks anywhere else in New York City.
So let me ask you if you're alarmed by this. The average daily number of cases over a 7-day stretch hit 552. My understanding is the city threshold is 550. But the numbers for people admitted to hospitals is still below the average. Number of percentage of people who tested positive is still below the threshold. That one slight change in that 552 number of the daily number of cases, is that alarming? Should people be concerned?
Yeah, so there's a very clear message with that. It's number one, we need to double our efforts now. This is not the time to declare victory or to take a step back and get relaxed. I know the last 8 months have been hard for me and for everybody in New York City, but this is the time where we need to work even harder to push through. Because as you said, our cases have gone up, but the hospitalizations have not. We have time to act together now. We did it in the clusters, we did it in Soundview, we did it in Sunset Park. We'll do it everywhere with New Yorkers, and we do have time.
So you're saying so far that one threshold going above is not too alarming. If all 3 go up, then obviously more action would be needed to be taken. Testing and tracing critically, especially with Halloween this weekend, right? And the holidays around the corner. There's been a lot of attention about, you know, you want to go see mom and dad, grandma and grandpa for Thanksgiving, potential for group gatherings. How are Test and Trace Corps officials, you, yourself, your staff, working this weekend and for the holidays ahead?
Yeah, so we are here 7 days a week calling every single new person diagnosed with coronavirus and every person that they identify that they exposed in New York City every day. Even with the clusters, this month, we had our strongest month ever for contact tracing. And look what happened. The percent positives, the number of new cases stabilized, and now the clusters are much better. We know what we're doing. We're going to continue to keep New York City safe. But we need to do it together with New Yorkers, and this is the hard part. I personally have never missed my mom's Thanksgiving dinner in Los Angeles. The biggest family tradition we have. I have to not go this year. She's devastated, but we have to avoid non-essential travel.
We were seeing members of the Hasidic community there on the screen. I know those areas of Borough Park were of concern. How are certain areas of concern that you were out making sure mask compliance was out in full force? How is that going?
Yeah, so when we started to do this, there was some resistance about wearing masks. Now, I would say our communities really get that we have to do this together to keep our schools open, to keep our communities safe. Mask compliance is definitely improving, though again, with the number of new cases, we can't let up our guard.
Understood.
What you can count on us doing is we've distributed 2 million masks. We'll do 2 million more. We'll do as many as we need to, as many as people as are willing to wear them.
We're out of time here, but I got to get this last question in because it's the first time we've really seen the numbers go up in New Jersey. They have qualified to be really on a list of travel, a travel ban list. What are your thoughts about folks from New Jersey coming into New York City right now? Are you able to monitor them? Or do you still have those checkpoints at certain bridges and tunnels?
Yeah, so for travelers in general, the hard part is a lot of people want to come to New York City. And in general, we want people, New Yorkers, to come back home and others to visit. But if you do that, if you're from one of the states that's higher risk, you have to quarantine for 14 days. You have to give us your information so that we can call you and offer to help. We've made more than 2 million phone calls to people coming back home or visiting New York City to help them to get through this period. But that's what it takes to keep New Yorkers safe. And I know it's an imposition, but it's important.
Understood. Dr. Ted Long, thank you for always making the time here on Pix 11. Do appreciate it.
Always a pleasure. Thank you.